Indications for a GI series is the hope that the medium will demonstrate the anatomy by outlining or filling a cavity or organ, demonstrate the physiology, be useful in determining anatomy in reference to size, shape, location, position, and contour, show defects in mucosal surface of an organ, luminal contents, and many more reasons. Contraindications can be that the patient is allergic to the medium picked, they do not tolerate fasting, there is too much anesthetic risk for that particular patient, or the time and cost involved may lead to other diagnostic procedures being better indicated. When selecting the correct contrast agent, there are options. Positive or negative mediums are available. Positive contrast media include barium sulfate and water-soluble organic iodides. Barium sulfate is used solely for the GI tract and can be administered orally or rectally. They are low cost and palatable, but cannot be used when bowel perforation is suspected and transit time is slow. We will be using barium in this study. Water-soluble organic iodides are preferred when bowel perforation is suspected. This agent readily mixes with blood and other bodily fluids and can be excreted through the kidneys. It has a rapid transit time and is non-irritating but has a bitter taste and is more expensive. Negative contrast mediums are low atomic number or low density agents like air, nitrous oxide, oxygen, and carbon dioxide, causing them to appear darker or radiolucent. A disadvantage of this is that there is less mucosal detail, and you must be careful to not overinflate organs such as the bladder. Before taking your radiographs, measure the patient in the positions needed for the films. This will give you the best measurements for evaluating the specific structures needed. Patient preparation varies depending upon the special procedure being performed, but in a GI tract study, the patient should be fasted, hair coat should be clean, and the correct amount of contrast medium should be given. Once you have set your radiograph unit to the specific shots needed, don all of the required PPE. Survey radiographs should be performed before the contrast study. For lateral radiographs, place the patient in lateral recumbency with the head in a natural position, forelimbs pulled cranially, hind limbs pulled caudally, and take the radiograph at peak expiration. For ventrodorsal radiographs, place the patient in dorsal recumbency, placing the patient in a trough if needed. Keep the head forward and straight, forelimbs extended forward, and hind limbs kept in a natural frog-legged position. Take the radiograph at peak expiration. Since we are using barium, we will be administering orally. The dose for barium for dogs is 8 to 12 ml per kg for under 20 kg and 5 to 7 ml per kg for over 20 kg. Cat dosing for barium is 12 to 20 mils per kg. We used 12 mils per kg. Once you have finished administering the barium, an immediate post-radiograph should be taken. Time intervals needed for a GI series in a dog is immediate, barium will be in the stomach, 15 minutes post, the duodenum fills, 30-minute post, the jejunum fills, 1 hour post, it reaches the ileum, 1.5 to 2 hours post, the stomach is mostly empty and complete small intestine is highlighted, 4 hours post, the small intestine and large intestine are highlighted, and 5 hours post, the stomach and small intestines are empty. The time intervals for cats are immediately post, 5 to 10 minutes post, 15 to 20 minutes post, 30 to 60 minutes post, 1 hour post, 3 hours post. These intervals are different because the cat GI tract tends to empty faster because by 30 minutes to 1 hour post, the complete small intestine can be seen. All of these time intervals need to be labeled on the X-ray itself. Endpoint is determined when the contrast agent reaches the colon or when the veterinarian ends the study.